My name is Annie Maw and I'm the Queen's Lord Lieutenant in Somerset, which means that I am the link between the royal households and the people of Somerset, because they like to know what we're doing, how we're managing, and in particular in current circumstances, they want to know about the good things that people have done in our county, and I can try and provide them with that information. I felt quite shocked to be told that I was regarded as vulnerable and that I would be seriously ill if I caught the virus, Covid-19. But of course I have paraplegia because I broke my back 18 years ago, and so I am probably somebody who would not do well at my age if I were to get ill. So I had to come to terms with that, and having had to come to terms already once with a serious situation regarding my health, I don't think perhaps I found it as difficult as some people would, but I do comprehend how shocking that must have been for a lot of people to be told that they must keep out of the public's way and make sure that they didn't make contact with that virus. Of course, now that we've been told that the constraints about movement amongst the populace have been relaxed a bit, we have a new set of challenges to confront, and that is quite difficult to deal with because I personally feel quite nervous and unsure, and I have only left my house and garden twice in the last 15 days, and tomorrow I am going to have to go out, and I have to do this. It's part of the next step, and I think that's another challenge which I have to face, and we all have to face, those of us who've been shielded. But we have to do it together, and we have to find out the answers to particular issues that we're not sure about, and there are lots of places that we can go if we need advice, and that's why we are so lucky. Over the next few weeks we've got to adjust to a little bit more freedom, and of course that means also that some of the backup that we've begun to get used to having is going to be less available, but the NHS volunteer support scheme is going to go on operating, and they will be able to advise about things like collection of prescriptions, transport for important appointments like medical appointments, and all of those sorts of things which are vital but you cannot think of a way of dealing with. They will be able to advise, and they will still be available even after July the 31st. I know that there are some people who are feeling really very anxious indeed, to a point where they are having sleepless nights and they are genuinely frightened, and I just want to say that that is very understandable. There's nothing abnormal about that at all under the circumstances that we've just been through, and you must always remember that there is Mindline that you can call, and that is open all of the time as a place for you to turn, and there is absolutely no reason to remain alone if you feel as vulnerable as that, and it, as I say, is not at all surprising if you do feel vulnerable, and neither is it abnormal. There's a very good website called Healthy Somerset, which I really recommend you visit. There is a lot of information about all sorts of different things that you can do to remain happy and healthy in the next few months while we get over this difficult time that we've had. And it will also advise you how to deal with any anxiety. There are lots of leads there, and the screen will give you all the information you need. I feel very proud of Somerset because compared with other counties we have had a very low incidence of the disease, and that is because as a community we have been compliant with the directions that we've been asked to follow, and I think as part of the shielded community I feel that we have pulled our weight, we've done what we were asked to do, and now the next step is facing us. We will know how to deal with that after the end of this month, when we're told that we can live a more normal life, we will be diligent, we will not take unnecessary risks, and when we are told each time that they take another look at the situation, told what we need to do, we will follow suit, we will do as we are asked to do. And I feel confident that as a community we are sensible, and we will get through this, we will get through it, and there is an end in sight. Even if it's not for some months, we will survive.